So today's video, I'll be mainly discussing about the reason why aspirin is contraindicated in peptic ulcer disease. So students and viewers, this is a very favorite and a very important question, what you ought to know in pharmacology, that why the patients who are on aspirin therapy, basically the patients who have undergone myocardial infarction, aspirin is constantly given to them. So there are certain patients where aspirin is given in certain conditions, but it is contraindicated in patients of peptic ulcer disease. The reasons we will be discussing in this video. So starting with First important point is that aspirin is irritating the gastric mucosa once the aspirin intake is being there. So aspirin, what it does is it irritates the gastric mucosa and leads to epigastric distress, nausea and vomiting. So this epigastric distress can be manifested in very many forms, such as the patient may have pain or discomfort in these just below the rib area. The patient may experience pain, discomfort, as well as there can be nausea and vomiting. So such discomfort is seen just because of epigastric distress, and aspirin, once it is given to such patients, this aspirin irritates the gastric mucosa and causes the epigastric distress, nausea and vomiting. Sure, okay. I'll be uploading the same video in Hindi, and thank you so much, Awais Baloch, you are from Pakistan, most welcome. So next, the next important point is that in acidic pH, we actually know that in the gastric mucosa, what do we find is the gastric mucosa is secreting the gastric acid as well as the HCl. Now, as in the acidic pH, what happens is this aspirin remains in the unionized form. Most importantly, in the gastric mucosa is secreting acidic, the hydrochloric acid, the gastric acid is being secreted, and in the presence of an acidic pH, aspirin remains in the unionized form. Now, since the aspirin is remaining in the unionized form, the drug particles, they are getting adhered to the gastric mucosa, they go and stick to the gastric mucosa and constantly irritate it. Okay, they also promote back diffusion of the acid into the stomach. So there is back diffusion, whatever the gastric acid secretion is there, the back secretion of the acid is there into the stomach. Apart from this, they also inhibit the prostaglandin synthesis, which is responsible for inhibiting the gastric acid secretion and increase the production of mucosa. So very important, I would like to emphasize, aspirin, what it does is, see, prostaglandins are basically responsible for inhibition of gastric acid secretion when it is in excess. All right. And also prostaglandins, they increase the secretion of the mucosa, thereby protecting the gastric mucosa. So whatever the mucosal secretion is there by the gastric mucosa, prostaglandins, they are going to enhance the mucosal production. They enhance the mucosal production in the gastric mucosa, and they are also inhibiting the prostaglandins. They inhibit the gastric acid secretion. So this leads to the occurrence of ulcer. So since aspirin is inhibiting the prostaglandin synthesis, so once the prostaglandin synthesis is being inhibited, obviously there is no inhibition of gastric acid secretion, as well as there is reduced secretion of mucus from the gastric mucosa. So ultimately this leads to the occurrence of ulcers. Aspirin also leads to reduced platelet aggregation. So if any kind of a scar is there, any kind of an ulcer is there in such patient, what it does is that the ulcers, just because aspirin is going to inhibit the platelet aggregation is inhibited. So ultimately whatever the ulcer is there, if it is bleeding inside, the aspirin is going to promote bleeding indirectly just by reducing the platelet aggregation. So whatever the internal bleeding is there because of the ulcers, that bleeding won't be controlled if the patient is on aspirin therapy. So I have summed up all 4 points. Firstly, aspirin is irritating the gastric mucosa, leading to epigastric distress, nausea and vomiting. Second point is that aspirin therapy, the aspirin is going to it remains in the unionized form in the gastric mucosa. It adheres, it attaches to the gastric mucosa, thereby thereby irritating the gastric mucosa. Apart from this, aspirin, what it does is it is hindering the, it promotes the back diffusion of the gastric acid or the HCl into the uh, gastric mucosa. The next important point is the aspirin is going to inhibit the prostaglandin synthesis. Prostaglandins are very important in the production of the protective production of the mucus, which is going to coat the gastric stomach lining. Apart from this, they are going, the prostaglandins has, since aspirin is going to inhibit the prostaglandin synthesis, so ultimately this leads to the inhibiting, this is responsible for the uh, causing the reduction in the gastric mucosal content of the stomach, and ultimately, since the mucosal content is being reduced, so ultimately that will lead to ulcer. And finally, aspirin has very one important role, that it inhibits the platelet aggregation. So platelet aggregation is there, so once the bleeding has started from the ulcer, ultimately it is going to bleed profusely because the platelet aggregation is inhibited, so there is no formation of the platelet plug, and ultimately the ulcers are going to bleed profusely. So students and viewers, this was a very short discussion as to why aspirin is contraindicated in patients of peptic ulcer disease. The students who want me, this is for you, Awais Baloch, you are from Pakistan. So the same video I will be uploading for you right now in Hindi, in order to make you, some the students who want to get the same topic in Hindi and understand better from me. So stay connected. The same video for you I will be posting in Hindi. If you like this video, give this video a thumbs up, and students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching. The next video in Hindi I'll be posting right now. Stay connected. Thank you.